Good morning, good afternoon, and good evening. Welcome everyone to this forum and this plenary session. I am Bobby Jefferson, and my role is Global Head of Diversity, Equity, and Inclusion at DAI. I'm very excited to convene expert speakers in this topic. So first, let me thank Dr. Jennifer Adams for her preliminary remarks. Those were fantastic. And we are going to talk today about healthcare and a lot of the technology associated with healthcare is now in the realm of science fiction to science reality, which is using AI, artificial intelligence, big data, cybersecurity, and we can use these to really transform health in low and middle income countries and the places that we work. So AI, big data, and cyber have the potential to improve and transform lives and the healthcare systems. There are opportunities to diagnose and do optimization of clinical decision-making that wasn't possible before. We can analyze medical treatment and the data around patients and longitudinal records to do some predictive analytics. And importantly, we can also help secure and protect the hospital and patient data from cyber threats and cyber criminals as well. So all these advancements in tools, has been accelerated because of the pandemic, because of COVID. So now the question becomes, as AI and cyber and big data are deployed more and more, both in mobile and in the cloud and deployed to different countries, what's the impact? What's not just the positive, but what realistically types of areas do we need for governance? And are there policies around data that we need? And how do countries take the leadership role to take advantage of these? We've really going to convene 3 expert speakers to talk about these important topics today. And so Dr. Aminata Amadou, she's the Senior Technology Coordinator for the ITU. Rebecca Saxton Fox, the Team Lead for Development Informatics Team at USAID. And Miriam Mimi Stankovic is Senior Digital Policy Specialist for Center for Digital Acceleration at DAI. So please let me allow each panelist just to introduce themselves, starting with Aminata, and then we'll turn it back over and get into the presentations.
Thank you.
Yeah.
Thank you. Thank you for the introduction. As you said, I am Senior Technology Coordinator at the International Telecommunication Union. My background is in engineering, electrical and computer engineering, and I will be happy to speak on this panel. Thank you. Back to you.
Thank you. Rebecca?
Good morning, everyone. Good afternoon, good evening. I am the team lead for the Development Informatics team at USAID. Been working here for almost 7, maybe 6.5 years now. Our team looks at advancing the responsible and appropriate use of digital technologies and data. I worked a little bit on the COVID-19 response in 2020, and I worked heavily with many of you on the agency's Ebola response back in 2015, 16, all the way through 18, I guess. I've worked for the UN, I've worked for implementing partners, and I'm really happy to be here with you today. Thanks.
Thank you. You're welcome. And Mimi.
Good morning, good afternoon, good evening to all of you. A pleasure to be with all of you here. My name is Miriam Mimi Stankovic. I serve as a Senior Digital Policy Specialist with the Center for Digital Acceleration at DAI. I have also served as a regulatory specialist in emerging technologies and health for UNDP, for the International Telecom Union, for the World Bank, IFC, and the African Union. It's a pleasure to be with all of you here. Thank you.
Great, thank you very much. So we will now turn it over to Aminata so she can share with us some information that is important to this conversation. So over to you.
Thank you. So my talk today will be kind of a more general topic. I will be talking about AI and big data for development and have some focus on the health sector. And this is based on this report from the International Telecommunication Union published in 2020, Emerging Technology Trends and AI and Big Data for Development. And I put the link of this report in this slide. Next slide, please. So I will be structuring my talk into 3 different points. The first one will be about some of the case studies of AI and big data in low and mid-income countries. Next, I will be talking about some use cases, and then I will finish my talk about some of the challenges and then some opportunities as well. So there are really many cases where AI and big data has been used in the health sector in low and mid-income countries. There are many. And here I'm showing just a few examples where AI has been deployed to respond to public health concerns by anticipating outbreak, for example, Zika in Brazil. In a similar type of example, in South Africa, there were pilots for deploying robotic pharmacists to dispense drugs to HIV patients and also to tuberculosis patients in order to kind of mitigate any issue related to the privacy of the patients. There was also an example in the Gambia where a probabilistic decision-making system has been used to assist rural healthcare workers to identify life-threatening conditions. And this is very important because in many of these low-income countries, you don't have necessarily access to doctors and to places to go for the healthcare. And by giving to these rural workers the ability to be able to detect these life-threatening conditions, that has been able to really help a lot in these cases. And then there was also a case where a social enterprise has used facial recognition in AI and the machine learning to be able to predict malnutrition in children. So these are just a few examples to say that there are many cases, but at the same time, there are many issues. And later on, perhaps I will be trying to say why, although we have many case studies where you have the use of big data and AI in health, this is not really helping a lot of issues related to healthcare in low and middle income countries. So in the next slide, I will be talking most about the use cases. So here, in which places have AI and big data been used in developing countries? And first of all, it is a matter of money. AI is expected to bring a lot of money, about 15 trillion by 2030. So this is a lot of money. Before we go to health, it's also economical matter. And then all these countries should be able to also be able to get a chunk of this money, but they must be prepared. And to get this preparation, there are so many things which need to be taken into account, such as the infrastructure, the strategies, the plan, the skills, and so on and so forth. And that will be what I'll be talking about in the next slide. Some of the use cases where AI and big data is being used to kind of harness this 15 trillion, and part of it in healthcare is in research and training, is also in the treatment and diagnosis of the diseases, but not only. And if we look at more than healthcare, AI and big data has been also used in these developing countries in agriculture, in transport, in energy. And I just want to show in this slide that health is one of the places where AI and big data it can be harnessed in low and mid-income country, but it also has to be taken into account the overall strategy of the country. What are the key points? What are the key sectors which are the priorities of the countries, like agriculture, which is still one of the key aspects of the economy in most of the low and mid-income country, like infrastructure. And then we can look at the specific horizontals like healthcare. In the next slide, I will be talking a little bit about some of the challenges of big data and AI in low and mid-income countries. Infrastructure. It has been shown recently, recent data from the ITU has shown that during the COVID, there had been a lot of increase in the number of users who have been connected to the internet from 2020 to 2021. Nonetheless, low and mid-income countries are the countries where you have the less people connected. Around 30% of people are connected to the internet. And one of the key reasons is that there is a lack of infrastructure. And in places, even in places where infrastructure is available, people do not have sometimes the skills, or sometimes the service is not affordable. So there is a need to have a strong infrastructure which is available, and the infrastructure include connectivity. So again, not only healthcare, we need to take into account the basic infrastructure, connectivity, electricity, which is lacking in a lot of these places, and then how can we use data center, and how can we use all this infrastructure for healthcare? There is a need to coordinate among the stakeholders to share innovation, to share data, and so on and so forth. Policies and regulation. Data privacy is one of the key policies which need to be in place in order to be able to use AI and big data. And again, not only in healthcare, but including healthcare. And yet, in most of the developing countries, there is no data privacy and data security policy. And in that case, data cannot be used really freely, and then people cannot feel comfortable sharing their data, knowing that there is no regulation or policy to be able to protect that data. And then data availability and interoperability. And yet, when the data is available, it's not necessarily accessible for the innovators, for the researchers. And in the use cases in the previous slide, I was trying to show, and that was from the report, one of the key use cases are research and innovation and training in the healthcare sector, but also in other sectors like agriculture. And if the data is not available to researchers and innovators, then this use case can never be achieved and cannot benefit the healthcare center and system and the other sectors which are really important for low and middle income countries like agriculture as well. And once data is also accessible, we need to make sure that the data is accurate and there is quality of data. And this has been shown to be very weak in many countries, the availability and the accuracy and the quality of data. And we know that in AI and big data, one of the key really hurdle is to have reliable data. Researchers use a lot of time to clean the data, to have accurate data which can be used. And then data must be trusted. People need to trust that the data they're sharing is actually is private. Is not, it has. Okay, sorry. I know that I'm out of time, Bobby. I'll try to wrap up. But people will. It's important for people to know that the data they share is kept in a private way. And then also, one point I maybe want to finish with is that data need to be unbiased. And in a lot of cases, it has been shown that the algorithm, not only the data is unbiased, but algorithms are biased. And algorithms are biased because people who create the algorithm sometimes come from the majority, and that majority does not necessarily apply to many low and mid-income countries. And there is the necessity that the algorithm and the data are local, created locally, so that we be able to avoid bias in the data. So I'll stop here and then take some questions later. Thank you.
Thank you for that, Aminata. We will definitely get back to your questions around bias in AI and data. So, but during the Q&As, so please believe me, we're going to talk about that. So, I now turn it over to Rebecca to give her thoughts and presentations as well.
Great. I believe I'm off mute now. All right. Good morning, afternoon, and evening again to everyone. So we're here today to talk about how AI, big data, and cybersecurity have the potential to improve, transform, and defend healthcare systems in low and middle income countries, and also to talk about the risks that they pose. So we're all sitting here virtually, obviously, because of the COVID-19 pandemic. You know, it feels obvious and almost normal now and almost silly to mention that we're in a pandemic, but I do like to pause and reflect on how dramatically different the world is now than it was 2 years ago. The pandemic has really turned the world on its head. I, like many of you, worked on the Ebola response, like I said, a few years ago. And wow, how different is this than that was? The role of technology and data in the response is remarkably different. So one silver lining, although I hate to say that, perhaps, is that the response has highlighted the importance of the work that you all do and that we as the digital development community do. We've seen that data, information, critical. Governments, private sector, communities, we're all using digital technology to understand COVID-19, to address COVID-19. Everyone needs accurate, timely data about disease spread, about vaccines, about other life-saving information. You know, and on the other hand, we've seen disinformation, we've seen misinformation spread online, thriving on uncertainty and fear, which has been, you know, frankly, risking lives and undermining trust in institutions. Meanwhile, we're on the precipice of witnessing an entirely new model of development that puts data right at the center of everything, based on the breadth of possibilities associated with greater use of artificial intelligence, responsible use, I might add. So the power of artificial intelligence and machine learning really comes from the ability to speed up our intake of data and our ability to act quickly on insights generated from those data. You know, maybe to triage tweets and texts following a natural disaster, or now during this crisis to rapidly prioritize response actions. This type of rapid response to critically important signals and data really wouldn't be feasible without advanced techniques like natural language processing or something else, for example. However, obviously, while AI can do a lot of good, we must be careful to recognize AI's potential for harm, which is often rooted in the very data that fuels its development in the first place. There is a propensity for AI to capture and propagate bias if that bias is present in the data. If we blindly place our trust in data without intentionally monitoring these kind of effects, we're really just going to be perpetuating this harm. So moving from AI to cybersecurity threats, which is another big topic on this panel, we all know this, again, is a rapidly changing landscape, especially as more organizations, people have transitioned to remote work during the pandemic. So our staff at USAID and our implementing partners, we're starting to see the pace and scale at which cybersecurity concerns are affecting development outcomes. We're seeing cyber espionage, phishing attempts, ransomware attacks against our USAID missions, against our partners, and other stakeholders in development around the world. We recognize the intended targets of these attacks are often these exact organizations we work with. They're targeting human rights groups, NGOs, local governments, contractors. And the global health community hasn't been spared from this. The pandemic has provided an unprecedented environment for cyber criminals targeting health systems. Hospitals across the globe are at full capacity or maybe near capacity in some cases. Attackers have been deploying disruptive ransomware attacks against healthcare institutions. These type of attacks cripple hospital computer systems, medical supply chains. They can lead to temporary or permanent loss of really critical data. And I know in the intro to this panel, or the text, we talked a little bit about the cyber attack on South Africa's largest private hospital last year. affecting admission systems. The hospital had to go offline while they were still receiving a large number of patients seeking treatment for COVID. So this is a big problem. I don't necessarily have to keep talking about why this is such a big problem, but maybe I'll switch to what is USAID doing to respond to this, both the opportunities of digital and data and the threats of cyber and biases, et cetera. So Jennifer Adams in her keynote, which I hope you all listened to right before this, spoke about all the incredible work that the USAID Global Health Bureau is doing in partnership with many of you. I'm going to talk a little bit about the work that the Innovation Technology and Research Hub is doing. We have a large portfolio of work, not necessarily focused on health, but of course, touching across all of these things. So first and foremost, we always endorse and promote the principles for digital development when looking at deploying any new kind of technology or old, technology, of course. We also, as you likely know, have our USAID-wide digital strategy, which outlines a path to strengthen open, inclusive, and secure digital ecosystems in all of our partner countries. So today, I'm really thrilled to have the opportunity to discuss how USAID is incorporating cybersecurity into its development programs and activities, and how we are adapting to an increasingly complex digital landscape, partnering with others outside the agency to make that adaptation happen. So we're really recognizing that cybersecurity and development programming is a critical component of our work, and we must expand our capacity as USAID to help governments, the private sector, civil society, and citizens mitigate harm through cybersecurity programming. So we have a new cybersecurity team leading this effort to build cyber capacity in our development and humanitarian assistance programming. We are working to ensure that cyber becomes a key part of each phase of USAID's program cycle, really thinking about how USAID's technology-enabled programming and activities, we really need to put cybersecurity as a thread that runs through all aspects of them to ensure resiliency and digital sustainability. So we're rethinking some of our program design and implementation and prioritizing efforts to build cybersecurity capacity in our development activities. To kick this off, we recently launched a cybersecurity primer, which you can see on the slide there. So please click copy paste the link into your browser. This primer introduces USAID implementing partners and others to the concept of cybersecurity as a development challenge. We strongly believe that successful adaptation to emerging cyber threats will require partnerships and collaboration between USAID implementing partners and other partners and stakeholders. And we're really looking forward to working with you all on this really important challenge that we're all still exploring and learning new things daily. And finally, before I run out of time, I just wanted to highlight, which is on the left side of your screen, AI, what we're doing around AI. So we're doing a number of exciting things, but I'll highlight one, which is the launch of our new Equitable Artificial Intelligence Challenge. So as I spoke very briefly about, there's a lot of, we're seeing more and more instances of the inequitable design, use, and impact of artificial intelligence tools. There's often unfair treatment in an AI system because of gender, especially. And those people often don't know that any discrimination has occurred. And if they do, they don't know what options they have to challenge the systems. So this is a big priority of the US government and of the USAID digital strategy. So to address this, our Bureau just launched the Equitable AI Challenge, and we're looking to award grants via co-creation process to innovative and creative approaches to help decision makers such as USAID and other designers identify and address actual and potential gender biases in AI tools. So please take a look at that and apply if you so choose. And thank you all. Looking forward to continuing this discussion.
Great, thank you, Rebecca. And we're certainly going to follow up with questions. I'm just amazed to have seen and supported USAID now that, cybersecurity in development, AI in development, and the bias around gender and technology tools in development. These are fantastic topics. I never would have thought about those 20 years ago. So this is really transforming conversation. Thank you for that. And we're definitely going to follow up with more. on that. So now I'd like to turn it over to my colleague, Mimi, and just to share with us a few words as well.
Yeah, so hi everyone again. Rebecca and Aminata, they both have talked about the opportunities which are offered by AI in healthcare in low and middle income countries. And Aminata mentioned that AI is expected to generate $15 trillion US to the industry, to the healthcare industry by 2030. And also the application of AI to healthcare globally is expected to register an explosive compound annual growth rate of 40% through 2021. And what was $600 million US market in 2014 is expected to reach $6.6 billion US by 2021. That is this year. So I don't have to mention what the opportunities are. AI can be used to aid in detecting health conditions early, deliver preventative services, optimize clinical decision making, and discover new treatments and medications. And it can facilitate personalized healthcare and precision medicine. And it can offer higher quality and a lower cost of care. Even though AI and big data can have a considerable positive impact on the healthcare system in low and middle income countries, they also come with certain challenges and caveats. First and foremost, the quality and availability of healthcare services in low and middle income countries lag behind developed countries, and this leads to disparate health outcomes, not disparate. Not having adequate digital and data infrastructure, as already highlighted by Aminata, impedes the prospects of AI deployment in healthcare. Secondly, the deployment of AI in standard healthcare delivery and administration is still minimal in low and middle income countries. And there are difficulties in scaling up projects and questions about the quality of health data. All this has been mentioned already. And AI can also accentuate existing inequalities and unwarranted variation in care. Without proper control, AI could codify and reinforce biases and exacerbate inequality. For instance, machine learning algorithms might not provide equally accurate predictions of outcomes across race, gender, or socioeconomic status. One example is facial recognition technologies that assist with identification, monitoring, and diagnosis. As facial recognition technology is increasingly utilized in healthcare settings, informed consent will need to be obtained to collect and store patients' images and for the specific purposes for which these systems might analyze those images. And right now, within the current healthcare system, this is impossible. Patients might not be aware that their images could be used to generate additionally clinically relevant information. To summarize, the use of AI in healthcare in developing countries is related to the following key challenges: data access and interoperability, which have already been discussed, data quality and bias, and data ethics and privacy. So I'm just going to briefly touch upon all of this. It is estimated that 2,314 exabytes of space are needed to store the total volume of global healthcare data that was produced by 2020. If this data were stacked on top of each other, they would reach 82,000 miles high or circle the Earth 3.2 times. So that's a lot of data. So they constitute 30% of the globally stored data. Now, for health data, to make decision making of the healthcare professionals better, the data sets need to be more diverse and robust. So right now, this is not the case. Data access and data quality barriers still prevent innovators and healthcare professionals from using data more efficiently and effectively in health, and the COVID-19 crisis has exacerbated these gaps even further. Often health data in low and middle income countries are incomplete or low quality. They're siloed and locked within institutions, and healthcare systems are grappling with linking different data sources and using data for secondary research. And interoperability is a huge challenge. Often health data sets are not interoperable and are not portable among institutions. So we need to be aware of this as well. Another challenge is that much of the healthcare data is unstructured, which impedes uniformly compiling and analyzing health data sets. I have given you here a picture which was taken by the WHO website. The better quality data analysis we have, the better we can understand people and address their needs through the deployment of AI and big data. Now, there is a huge variance in the amount of recent data across the different indicators between low and middle income countries and developed countries. As we can see, most higher income countries have more recent data for health related indicators clustering around 60 to 80%. And there are 35 countries, 22 middle and income and 8 low income, where over half the indicators lack recent data. So data is a huge issue, and AI runs on data and health data. Then I'm going to talk briefly about data quality and bias. This has been already addressed by the other panelists. One of the key impediments to the effective deployment of AI in healthcare is access to fair, that is findable, accessible, interoperable, and reusable data. In developing countries, this problem is exacerbated because data are not always digitized, not just accessible or available. And data representativeness is another problematic issue, which is related to data quality, hence the diversity, inclusiveness, and robustness of data healthcare sets, data sets is very important. So AI's output is shared by the data that is fed into it. Computer-based recommendations are taken at face value, assuming that whatever results an AI algorithm portrays is objective and impartial, but this is not the true. As we have seen, algorithms carry biases and data also carry biases. For example, women and people of color are typically underrepresented in clinical trials. If algorithms that analyze skin images were trained on images of white patients and then are applied more broadly, they could potentially miss melanomas in people of color, and this can have huge consequences. So we need to be also cognizant of this. And then data ethics and privacy, the other panelists have touched upon these issues as well. Data privacy issues are significant for digital health and AI solutions, since health data in developing countries are generally government-owned, raising concerns about private companies gaining access to the data and potentially profiting by leveraging it for their uses. So we have to be also aware of this. Many local stakeholders are concerned about AI tools requiring access to large amounts of health data, which is very sensitive and private, personal, because they fear this would increase the risk of monopolistic behavior if a single private player assumes such a significant role within a country health system. So I have talked about AI biases, the other and ethics. We need trustworthy AI. We need AI that incorporates a human in the loop concept. We should make sure that AI-powered tools can be applied equally to different groups of people. So information, and I'm going to wrap up here, information from specific population groups tends to be missing from the data with which AI tools learn, meaning that the tool might work less well for those communities. For instance, a team of UK scientists found that almost all eye disease data sets come from patients in North America, Europe, and China, meaning eye by disease, diagnosing algorithms are less certain to work well for racial groups from underrepresented countries. There are other problems, other challenges that are related to deployment of AI and big data in low and middle income country settings. But I am available to answer any questions and by the moderator and by the audience. So thank you so much for your attention.
Thank you for that, Mimi. I appreciate the examples that you've used around AI and algorithms, that it's not just the algorithms, but it's important that the algorithms have diverse data sets and who programs those algorithms. So we'll definitely have a follow-up conversation about the importance of that. So before I ask the questions to the panelists, I just want to encourage the participants and attendees to please put your questions to the panelists into the chat, and we'll scan those and be able to answer as many as we can. So we want to make this a interactive plenary session where your questions around AI, cyber, big data is also addressed and answered. So please feel free to put those questions in the chat. While that's happening, I'd like to ask Aminat the following question. So I have a lot of colleagues from Kenya and Ethiopia and Nigeria, and they've been working on, they've been involved in AI and machine learning, but it always seems as if there's other organizations that are bringing in these AI and tools and solutions and algorithms into the countries or into the healthcare systems. If they have an interest and they're actually the leaders and want to participate, what should they do, or how do they get involved? So that way it's not just a black box of AI and tools and all this techly talk. How do they become involved so they're empowered to actually have ownership over some of these technologies and tools in their own countries?
Thank you, Bobby. So I think that there are maybe 2 points to discussion. First of all, my background is in academia, and I do know that there are many people working on AI and big data in Kenya, in Nigeria, in Rwanda. They are facing a lot of issues. One of these issues faced by many of these researchers and innovators is what I said earlier: they don't have access to quality data. The data which is within the country, so data generated by government has a lot of data, healthcare has a lot of data. This data is not accessible to these researchers and innovators. And to be able to use AI, you need to have the data set, and they don't have access to the data set. Mobile data is a huge amount of data available in low-income countries, but yet mobile data is only available for mobile operators who sell the data, and these researchers cannot buy this data. The data must be accessible. And once the data is accessible, I think the researchers and the innovators can use the data and then make use and then create applications, local applications. And this is also what I said earlier, and so the other colleagues said earlier, data bias. If the data is coming from Europe, from other countries, the data will be biased because the data has not been trained with local data. So we cannot, although we can import car, we can import a lot of things. For AI and big data, it is important that first a national strategy be put in place. And again, I would like to insist that it cannot be only health, it cannot be only agriculture, it cannot be isolated. It has to be one national strategy to looking into account and saying, what is our need? Health is our need. Agriculture is a priority. And we will create a strategy which will take into account all of this. And if we want to succeed in this strategy, then we need to make data accessible. And if data is not yet there, one advantage of data is we can always create data. So there is a lot of healthcare data available, but it is maybe on paper format. So can we have access to this data and make it digital? But what do we need to make this data digital? Then we need data privacy policy, which we don't have yet. And then I think the big step here is at the policy maker shoulder, where they need to make sure that the policy is in place, the strategy is in place. And I think all these innovators and researchers can be able to do their work and then make it now this data accessible to them. Make sure that the policies kind of incentivize the mobile providers to share also the data and the government to share the data. And I will finish here. I think also that there are many people interested in working on AI and big data, but yet there is not enough skills in low and mid-income countries. It is expected that in the next near future, almost all jobs will need some time of digital skills. And yet there are limited people with digital skills in these countries. And I think this strategy must put as priority. How do we build skills so that in the next future, where all the jobs need digital skills, the young people are equipped with that skills, with those skills and be able to innovate. And that's, I think, the only way we can avoid the bias. And that's the only way local innovation can make sure that we're really creating AI and big data innovation, which will fulfill the need of the population and then contribute to the economical development of the country. And then to have this chunk of 15 trillion or more, I think economy is also important here. Back to you.
Thank you. I think that's an excellent point about involving our colleagues and our leaders in the countries themselves before we deploy our fancy AI and big tech tools. So that way it's inclusive and that the data set is not just diverse, but represents them as well, because we've seen where data sets and algorithms are programmed in the US or UK, and the algorithms, definitely have bias, or as Mimi mentioned, gender bias are included in some of the algorithms as well. But one of the things I've noticed is that since the pandemic, many of the organizations have gone to remote access. So a lot of the staff and employees are all remote. And so a lot of the data is also remote. And so that potentially gives an opportunity for cyber threats, or increased cyber threats, because a lot of organizations overnight went from clinical services to now telemedicine, and civil society groups now are having individuals who are remote. So Rebecca, what are some important steps the digital health community can take to mitigate some of these harms around cyber and cyber attacks and misinformation? I mean, just where do I start, and why are these cyber criminals and organizations interested in accessing the data within the health data and the health system for my local organization as well?
Thanks, Bobby. Yeah, I mean, it's a tough question. We're all working together to figure this out. And so one thing I'd love to say is that we would love to work with all of you, everyone listening here in the audience, to tackle this question. In terms of what USAID is doing, as I mentioned, we have a new cybersecurity team, one that coordinates with, but is distinct in purpose and scope from our CIO's office, who also has a cybersecurity team focused more like on cyber risks to our agency. So I'm sure a lot of your organizations also have that. So we have this new team that's really looking at how to build our partners' capacity to mitigate cyber risks to programming. So we're doing technical assistance, we're doing toolkits, we're doing trainings. We have an agency-wide group that works to coordinate and collaborate and learn about what's taking place in digital ecosystems where you all work, in the countries where we work. Representing USAID at interagency discussions to understand how the US government more broadly is doing this. And of course, coordinating with our CIO's office and their technical expert and their cybersecurity portfolios. So all this to say that we're building this out, but also that a lot of it requires coordination, talking to each other, working together, building capacity, as Aminato was saying as well, building capacity of how to recognize threats and how to mitigate them. We also recognize that many of you have your own cybersecurity tools and responses. it's, catalyzing creativity and innovation in a strange way, the way that we're mitigating these risks. So like I said, we're learning organically, and we'd really love to hear from you all about your experiences and solutions too.
Thank you for that. And I will say that my experience has been, because I'm helping mentor a number of startup companies, trying to help them understand the importance of have cyber insurance. So even though they're developing all these technologies and tools, just to have their own cyber programs and cyber insurance to be prepared, so that way it can mitigate the risks in the future as well. So so I really applaud USAID's efforts, both with coordinating with other donors and being very involved in the cybersecurity space to help defend our healthcare. Because we know and we've seen not just a lot of misinformation that's occurred during the pandemic, but we've also seen that there's has been a digital transformation that's occurred because we're working remotely, we're working from home. A lot of new organizations and new companies are springing up, and that allows us to create new AI tools, new solutions that weren't there before. So my question for you, Mimi, is actually one from the audience, which is, as we begin to develop more AI tools and more machine learning and big data, for the past 10 years, we've developed a lot of solutions fragmented. And then we tried to figure out later how to have interoperability and get them to work together. Again, I haven't seen yet around how to get AI tools to sort of work together yet. But one of the questions is, how do we, in advance, we know we're going to use AI tools. We know we're going to use these big data. We know that we're going to have cyber security types of issues and that we need to address. So how to avoid that fragmentation and siloing around diseases and things now? And, how do we have like the governance structure? Should there be governance structures within the countries for AI, for big data, for cyber? So that way efforts are coordinated, or, please chime in on this.
Yeah.
Well, and also I'd like Rebecca to follow up on that as well, around some of the governance. Yeah.
Well, thank you. This is basically what I'm working on. What I'm working on as a senior digital policy specialist with the AI, and also as a member of the drug development committee of the Global Partnership on Artificial Intelligence. We need innovative data sharing mechanisms. So both Rebecca and Aminata, they also mentioned that data sharing is instrumental in opening up data, but we also need data protection practices. We need data protection regulations and rules if these are not in place in a particular country or region. We need cybersecurity policies at micro level, but also at national level. So cybersecurity is also very important, and information security in general. So suitable innovative mechanisms in sharing of health data are built upon two considerations, I would say. So number one, health data are considered data of public interest. Okay, they are sensitive, they're private, they're personal, and any health data. The second consideration would be any health data sharing mechanism should always incorporate privacy by design considerations. This also requires a policy consensus on key questions of how to ensure the consent of the patient and define ownership of data, especially to share it with AI developers and researchers for research or for data deployment and processing. And this is where policies and standards, around de-identification and anonymization can balance privacy and use health data for health innovation and overcome those silos. And there are experimental and novel models for data sharing, such as data trusts, data sandboxes, and collaboratives, especially in developed countries. However, these experimental models might not be readily transferable to developing countries or low and middle income countries. So key preconditions for making these health data governance systems work are data protection, cybersecurity, and ethical principles in AI design and deployment that is human is for the human and about the human. So thank you so much. Over to you, Bobby.
Great, and I just wanted to see if Rebecca had a follow-up on some of the governance, because again, I was very excited to see the gender program, co-creation program that you mentioned, but just the cyber premier that enables some of the governance pieces.
Yes, we are working on governance pieces with our partner country governments. Sorry, we have some more kind of primers and other documents coming out soon around data governance more broadly, as well as some of the cyber security points that I've been talking about. I might just say that sometimes when thinking about a lot of these things, I like to just go back to basics as well. I get overwhelmed by how many risks there seem to be out there and how scary the environment can be sometimes. And so if you're feeling that way, if you're grappling with all this, you're not alone. Like I said before, I like to start, back with best practices, learn from other people what they're doing, what their best practices are, what's working. Go back to the principles. You all have a lot of principles for digital development as well as for digital health, as well as the principles for digital development. Start there, elevate the do no harm principle, make sure that you have policies in place at your organization to protect your data and the data of your beneficiaries and who you're working with. Make sure you're training your staff, make sure you're training yourself, you're learning how these threats are evolving. Put in place practices, not just policies, but practices that are followable at your organization that people are actually going to do. So what is that? Principles, policies, people, practices. And, think about any sort of technology that you're deploying, whether it's AI or whether it's just a mobile phone. Make sure it's done ethically and responsibly. There's not always going to be a checklist for how to do that, how to be responsible, but having some kind of an ethical framework can really help when we're thinking about all of these new things. We have our guide for using data responsibly that I put up earlier on the screen to help frame a discussion like that at your organization. But just that we're all responsible for this. It starts with all of us. We should be helping our partner countries work on these policies and higher level things, but we all have a responsibility to work on our own selves and our own organizations when thinking about this. So if you're grappling, we're all grappling, but let's do it together.
Excellent point. So one of the topics I want to raise occurred earlier, which was when Aminata mentioned around a lot of the AI tools. And so again, Amazon Web Services and others and Google, and, they've got facial recognition systems. They have AI tools you can just download, or even you don't have to download them. You can use them online. I've used them for quite a bit. And the question I have is, should we put our trust in the results of these AI tools and algorithms if we don't have an understanding of how they work, or if they have, or if the AI tool is learning, but it's learning things it's based on incomplete or minimal data and data sets? So we mentioned earlier, if it's not a gender diverse data set or lack of data that represents the countries, can we really put our trust in some of the results that are coming out of these AI tools? And then the question from the audience was, is there a mechanism that allows or ensures the quality around some of those algorithms and tools? So let me start off with you, Aminata, because at ITU, I know you've been wrestling with big data, education, training, but just trying to understand any of the quality level issues associated. Again, it's always my old days of GIGO, bad data in, bad data out. And so how do I ensure that both my algorithm and that the data and results that are coming out can be trusted? And what do I do? I mean, where do I start? How do I know what even the right questions to ask? And so is there a global or country mechanism? So I know I asked a lot, but this important topic you raised.
Thank you, Bobby. I don't know if there is a country mechanism to do that, but as you said, we have actually here two aspects. We have the input, which is the data, we have the system, which is the algorithm, and we have the output. So if we have bad inputs, data, no matter how good is the system, the output will be bad. So that's why we were all saying here on the panel that we need to make sure that the data is of quality and accurate. And we need to have data which is unbiased, which represents everybody, not only a chunk of the population, even if that part of the population is the majority. Data must be representative of the place or of the population. So that's why it's important to have quality data. Now, the other point to actually cross-check is the system, the algorithm. This is where we have the main issue, because in many of the AI algorithms, they come as like black boxes. You don't know what is inside. And that's where people are losing the trust. Can we have transparency in the algorithm? And I think that's what we should ask from this AI creator. Put your algorithm transparent so that we know what is in, and I can try it and I can verify it. But at the same time, the creator of these algorithms also argue that when we have put money to create this algorithm, we don't want our competitors to take advantage of this research. So that's a little bit the issue we're having. But I think one key point is to make sure that the algorithm is somehow transparent, even if it's not fully transparent, so that people can actually know that they are able to verify it. And then the data at the input should be of quality. It really should be representative. And that's very important for low and mid-income countries who, again, do not produce a lot of these algorithms, do not train a lot of these algorithms, are importing the algorithm and sometimes the data, and the result can be not what is expected. Back to you.
Thank you. Mimi?
Well, I'm going to tackle this question at two levels. The first level is the micro level. Okay, so the micro level is, and I'm talking about healthcare specifically, AI developers in healthcare space should use justice, equity, diversity, inclusion during design and development of their products. So there should be always human in the loop when designing these algorithms. And then on the other hand, we have also doctors and medical staff. They should be trained to somehow understand when an AI system is or is not reliable, safe, and effective. So that's number two. And then number three is the patients. Okay, so we need to raise awareness, especially in low and middle income countries, about what to expect. There is also within the GDPR, for example, but it's within the preamble. It's not provision per se. There is this right to explainability. Okay, so citizens in the European Union, they have the right to know how the algorithm works. Okay, so but whether this is doable, whether this is feasible in practice, I don't think so. So we need to work on designing algorithms by privacy by design, by following the principles of privacy by design. So that's at micro level. At macro level, what the governments can do, and what Aminata and I have been working on for a long time on developing national AI and big data strategies for development, is they need to make sure that AI-powered tools can be applied equally to different groups of people. So they need the data sets, they need to be robust, they need to be inclusive, they need to contain local data. Okay. However, even if diverse data sets are generated, this might not translate into AI tools rolled out reliably in low-income countries where disease profiles differ from those in developed nations. And this is a huge problem. To illustrate this, for example, in sub-Saharan Africa, women are diagnosed with breast cancer younger on average than their peers in developed countries such as the United States and Europe. And their disease is more advanced when it is diagnosed. So diagnostic AI tools trained on mammograms from Europe and United States are trained to identify the disease early in older women. These results and AI training sets could have devastating results if and when deployed in sub-Saharan Africa. So I would say awareness, building awareness, raising awareness is key in this respect. Thank you so much. Over to you, Bobby.
Great. Thank you for that specific example, because this, it involves real lives and real people. So as we begin to wrap up, I appreciated the conversation, and what I have learned, I want to make sure you have the final word to share with the participants and groups. So Aminata, if you can give us your final 1 minute, 30 seconds of to leave the audience with, that would be great.
Thank you, Bobby. Well, I just would like to end by saying that AI and big data can be a good opportunity for low and mid-income countries. However, I think that they really need to get prepared to be able to harness this new opportunity. Health is one of the key sectors where you have a lot of data. But at the same time, it's challenging because health data is also very private, very personal data. So there is a need in this preparation to make sure that the policies are in place, they can be enacted, that people data will be safe, but a lot of innovation can happen. And I would like really to say that we need to encourage local innovation. That's the only way the low and mid-income countries can take advantage of AI and big data for health, but also for the other sector. I think that there is a way to look at it in a harmonious way, not isolating the verticals, health, agriculture, but looking at them together, because the principles are the same and they can leverage the synergies for development. Back to you.
Thank you. And Mimi, if you can give us 20 seconds to wrap up.
I'll be just brief. So in low and middle income countries, building trust in AI solutions in healthcare is about ensuring that AI tools meet demand on the ground and build trust and buy-in from local communities they are intended to help. So that's my 20 seconds.
Thank you.
Yeah.
And Rebecca, I want to give you the opportunity to have the last word here.
Oh, sure. Thanks, Bobby. Thanks to everyone. Maybe I'll just close by saying, echoing everyone else, I think working with local actors as much as possible, not just as a source of data, but as active co-creators in how we're creating data sets and creating algorithms and creating tools and incorporating them into the programming that we do. We have to have partnerships with local actors in order to be successful. And at USAID, we also believe in having partnerships with all of you and multi-stakeholder partnerships, between each other. Good communication is vital in this. So yeah, we are encouraging you to get involved. I put my email up on the other screen, and I'm happy to figure out how to share it with you all, but please do reach out. Please apply for the Equitable AI Challenge. Please reach out and learn more about our cybersecurity work. And we'd love to hear from you and what you're working on and how we can learn from you as well. So thanks so much. Sorry that we couldn't all be together in person, but glad to be able to present today. So thanks to everyone.
So thank you to each of our panelists. This concludes our session. Thank you all for participating. And we'll try to follow up with you, ask questions separately. Thank you all.
Thank you.